one of the biggest advances in shoulder surgery has been something called the reverse replacement prosthesis. It's a replacement surgery, but it's been one of the biggest advances in all of shoulder surgery for sure.
So you take out the shoulder joint, this sort of cup.
That's right.
And then you make a cup out of the bone that goes there.
You've got it. We reverse the mechanics, the normal mechanics. We reverse it. It started in Europe, and first time I saw it, I thought it was crazy, and I thought, no way this will work. But I tell you what, the people who thought of this, they really thought of an amazing thing, and it's offered a lot of patients relief from pain and ability to get their function back.
So what seems to be the biggest change, improvement of the shoulder when you do a reverse replacement? What can the patient do?
Well, pain relief, number one, but one of the biggest is the ability to have overhead motion once again. You think about it, and so much of our life is accomplished over shoulder level. And patients who can't reach above shoulder level are usually frustrated. They can't reach for a coffee cup. They can't do their hair very well. You know, simple things. And of course, more athletic things like serving a tennis ball or pickleball in this case. You know, you got to serve underhanded. But, you know, hitting an overhead in pickleball. Those are things that patients really want to be able to do. And a reverse usually allows them to get back to that.